Hello everyone, welcome to a new video. Today's video is very interesting and it is solution focused, so it will help everyone, those who are struggling with overthinking and anxiety. So if you haven't subscribed our channel, just go and subscribe us. You can stay with us and get latest updates. Thank you. So now let's start today's topic. You know that moment when your mind just won't stop, when you wake up, and before you even open your eyes, your brain is already playing yesterday's mistakes or forecasting every possible disaster for today. And what if I get it wrong? What if people think badly about of me? What if I fail? And you try to push the thoughts away, but they sneak back in. They whisper, they spin, and as your thoughts spin, your body follows your heartbeat faster. Your chest tightens, sleep feels distant, and focus becomes impossible. So I am Dua, your consultant clinical psychologist. Over time, I have helped many people trapped in a mental loop, overthinking that fuels anxiety, anxiety that fuels more overthinking. Okay, so today in this video, you will discover practical tools, cognitive, mindful, and behavioral that really work. You'll leave with strategies you can use immediately and a plan to reclaim your calm. If you are tired of the noise in your mind, stay with me. So let's first discuss what is overthinking versus anxiety. So what do we mean by overthinking and how is that different from anxiety? Because knowing which you are dealing with is critical to choose the right tool. Overthinking means repetitive, often unproductive mental loops, replaying past conversations, imagining future worst case scenarios, what if thinking, analysis paralysis. It's mostly cognitive, mental, and internal. You might not feel strong physical symptoms, but you feel fatigued mentally, perhaps guilty, perhaps trapped in your mind. So, anxiety, by contrast, often includes overthinking but also involves bodily responses, racing heart, restlessness, and muscle tension, sleep disturbance, high worry, even when there is no specific threat. So, anxiety is more pervasive mind, body, and behavior. The tricky part is the two feed each other. Overthinking triggers anxiety, and anxiety makes you overthink more. As this repeats, the two gets entangled. Distinguishing them helps, because some tools are better for cognitive work, others for calming the body, others for breaking behavior patterns. So let's first discuss about the cognitive tools. So let's dive into effective cognitive techniques or tools for your thinking that can interrupt the overthinking and anxiety loop. Okay, so cognitive restructuring and challenging distortions start by noticing thoughts that cause distress. What if I fail? What if people criticize me? I always mess up and ask, okay, is this thought absolutely true? What evidence supports it and what evidence contradicts it? Are we using all or nothing thinking? Magnification? Jumping to conclusions? Then reframe it. Find a more balanced perspective. Example, I might not do this perfectly, but I can learn. People are more forgiving than I imagine. Okay? Concreteness. Okay? Concreteness training is When you catch yourself in abstract thinking, I'm useless, everything is bad, pause and ask for detail. Where? When? Who was there? What exactly happened? What did I say or do? What wasn't so bad? Doing this again and again trains your mind away from overgeneralizing, which feeds rumination, and that is inspired by research that shows that it reduces rumination and disrupt the depressive symptoms and symptoms related to anxiety. Okay, thought labeling and thought stopping. Labeling is this is overthinking or this is worry. Just the act of naming gives you distance, okay? And the thought stopping, use a mental or physical cue, just say stop. Imagine a stop sign or a brief interruption. When you notice the spiral, then redirect to something productive or grounding. Over time, this becomes easier. The automatic nature loses some of its intensity. Then we have awareness and mindfulness tools. These techniques help you relate differently to your thoughts. Instead of getting caught in them, you observe them. Mindfulness, meditation, and breath awareness. Even 5 to 10 minutes a day of meditation focus on noticing the breath can help. Thoughts will come. You notice them, let them pass. Return to breath. Apps, guided meditations, body scans, mindful walking, anything that cultivates present moment awareness. Be present in that situation rather than thinking about the past and future. Live the present moment. Okay? If you keep on thinking about the past, you will again experiencing overthinking. What I did, how I did, what if, this what if questions. You have to erase these what if questions from your mind. Okay? Just focus on what you have right now and live that moment. And don't skip that. Because time is really precious. It won't come back, okay? For instance, if you pass by a street, or if you see a sparrow, if you see someone cycling there, if you are going for a walk, so just whatever you are observing, whatever you are watching right now, next day or even after 1 hour you would walk through the same street, you won't see the same people, you won't see the same sparrow, you won't see the same people, you won't see the same person who was bicycling there. Cycling people won't be there, or the children will be different, so things would be different, things won't remain same. Time is very precious, time won't come back, okay? So the person you have, the people you have, the surroundings you have, whatever the positive energies that is around you, just take them, okay, and live that moment. I'll also make the positive videos to inculcate positivity in yourself. So stay tuned with our channel. And if you haven't subscribed us yet, just go and subscribe us to get these positive energies and to instill positiveness and happiness in yourself. Okay. Then moving towards another technique, that is grounding techniques. One example is 5, 4, 3, 2, 1 technique. Okay. Name 5 things you see, 4 things you can touch, 3 things you can hear, 2 things that you can smell, 1 thing that you can taste. It pulls you out of your head and into your senses. Okay? It would distract you from this overthinking patterns, and it's really helpful, okay? Also, breathing techniques like box breathing or 4-7-8 breathing, inhale, hold and exhale to calm the physiological arousal, okay? If you are really deep breathing is really necessary, and it helps a lot with clients who are having anxiety. Please practice deep breathing, especially in the morning, in the noon, and at night before sleep. Okay, at least 3 to 5 times, at least. Okay, and deep breathing really helps people. Okay, then awareness of thoughts without judgment. Observe thoughts as mental events. Okay, not truths. They come, they go. You don't have to believe everything your mind says. It's not about fighting thoughts or suppressing them, which tends to backfire, but noticing, giving them less weight. Okay, you are, let's for instance, you are prioritizing these thoughts. Okay, because you think a lot about those negative thinking patterns. You think a lot about those bad events or experiences that has happened to you. So for instance, because you have prioritized them, and let's suppose if we talk about a percentage, so you have given them like 100% or 90% to them. And like for instance, if you have any positive experiences, you have given them 20%. So that is why this is not present in your mind. If you give these positive events, if you keep on recalling and remembering the positive events that has happened to you, that is causing and giving happiness within yourself. So just think about that rather than thinking about the negative events. The more you think about it, the more stressful or depressive phases you would experience. Okay, and the more anxious you will be. You would be like, okay, I don't know what will happen next, I don't know. You would be really restless. Okay, and just keep on doing deep breathing. It would really help you. Okay, whenever you feel anxious. Okay, and stay and feel the calmness in your body. The next is behavioral and lifestyle adjustments. Cognitive and mindful tools are really powerful, but changing behavior and lifestyle creates lasting change. Worry scheduling, like worry time. Pick a time each day, maybe 15 to 20 minutes, that you can reserve just for worrying, overthinking. Okay, outside that time, if a worry arising, you note it and postpone it. Okay, during that scheduled time, you can address it, journal it, and decide if there is an action. It helps contain overthinking. Okay, like for instance, if you are having a thought, you can keep on writing about them, you can find a solution for this. And like for instance, if you are at work, okay, and if there is a situation that arises you, or there is a problematic any event or anything that has happened, so you're addressing to that in a certain way to just resolve the issue. Okay, so the same thing that you would go and, like for instance, if there's an electric issue, you would go and you'll ask someone to just resolve this issue. Same goes for your thinking patterns. Okay, you just go and you can resolve them. Okay, you will just go and clearly write about it, what solutions we can do, and all of these things. Just deal with them in a really peaceful and calmful way. Okay, journaling, writing down your thoughts. What worries are present? What are possible actions? What things are outside your control? Helps externalize thoughts. Okay, keep distancing yourself from these thoughts. Okay, physical activity and sleep hygiene, regular movements, walking, exercise, yoga, movement helps reduce stress hormone. Okay, improves mood. Sleep, maintain consistent sleep schedule, wind down routines, limit screen before bedtime, cool, dark, and quiet environment is very necessary. Poor sleep fuels bigger anxiety. Okay, so work on your sleep patterns too. Reducing triggers and emotional overload. Limit exposure to worrying stimuli, news, social media if it triggers, especially before bed. Okay, before you sleep, just think about the positive experiences that you have experienced. Okay, just view those things on social media that is really positive. Okay, don't view those news, don't watch those videos that are triggering for you. Okay, And I'm giving you a tip, like if you know someone who is going through anxiety or who is going through any issue, any mental health issue, just please be really really conscious about using certain words. Just go sit with them, be empathetic, okay? Use certain words that are really helpful for them. Don't use those words that hurt them, okay? Because words matters a lot, okay? Then set boundaries for decision making. Don't overanalyze choices beyond a useful point. Sometimes good enough is enough, okay? Self compassion and perspective shift. Notice harsh or critical internal dialogue. When you think, I should know better or I am weak, ask yourself, would I say this thing to a friend? Can I be kinder? Use affirmations, gentle self-talk. Acknowledge that being a human means uncertainty, mistakes, self-compassion reduces the emotional intensity of overthinking, and talk with that friend who is really empathetic and is really non-judgmental, okay? And when to seek help and therapy, most people would benefit a lot from self-help tools, but there are times when professional help is really essential. So signs it may be time for you seek for professional help as you can't sleep for weeks or your sleep is consistently disrupted, panic attacks or intense anxiety episodes interfering with daily life. You avoid many situations out of fear of overthinking what will happen. Thoughts are intrusive, persistent, uncontrollable, maybe even distressing beyond self-help, and decline in mood, motivation, relationship functioning. So then you can go for professional help, okay? CBT, that focuses on cognitive distortion, behavioral change, exposure to fears, metacognitive therapy. It shifts beliefs about thinking, reducing worrying about worry, and mindful based therapies like MBCT that combine awareness and cognitive work, ACT, acceptance and commitment therapy, learning to live with unavoidable thoughts and feeling while focusing on what matters in your life is really important, okay? So just you can seek for professional help and it is really severe, or you feel like this is disrupting your personal, occupational and social life, okay? If it is causing all disruption in all areas of function, just go and seek for professional help. And being a psychologist, you guys can comment, tell me what issues you are facing. You guys can connect with me anytime. Just write to me. I'm always available for you. If you need therapy, if you need any kind of help, I'm definitely available for you. I'm available to listen you, to show you support, to provide you therapy. Just let me know in comments or in anything that you need. I'm always available for you, okay? So you are not alone. I am with you, okay? Just remember that, okay? So So your challenge for the next 7 days is each morning start with 5 minutes of mindfulness or breath awareness. Identify one recurring negative thought. Use concreteness training or challenge it. Pick a fixed worry time. Commit to postponing worries outside the window, then journaling them, and practice self-compassion when you feel harsh, self-judgmental, and creeping in. Progress may feel slow, but every time you use one protocol, you weaken the power of overthinking and anxiety loop. You are learning new patterns. You are reclaiming peace. You deserve a mind that gives you rest, not unrest, and start today. Okay, don't delay this. I'm always available for you. Thank you so much for being there in this video. Thank you so much for your listening. And you are not alone. I'm here with you. You can write to me if you need therapy or anything. I'm always available for you. If you haven't subscribed our channel, just go and subscribe us to get our latest updates. We'll stay connected, okay? And share it with your friends if anybody needs it, because it will be really helpful for you to creating a community, and it will be really helpful. So thank you so much, and please practice these techniques to reduce your overthinking patterns and to reduce the sleep issues. Thank you so much.